Breast milk is uniquely designed for newborns, and it is full of incredible proteins, immunoglobulins, active agents that can help the infant fight infections. Essentially, whatever infections a mother has been exposed to, her body makes antibodies that then filter through the colostrum, which is the thick, creamy fluid that comes out in the first 48 hours after she gives birth. So it's really important to put the newborn to the breast as soon as possible after birth, do skin to skin, and start that process because that initial fluid is so helpful for infection protection. Breast milk then adjusts as the infant grows and is uniquely tailored to the growth and developmental needs of that infant. So it's important that the mother exclusively breastfeed for the first 6 months of life, and then when solids are introduced at around 6 months, that she continue to breastfeed right up until 2 years or beyond, because that breast milk is uniquely designed for her growing child. I'm very passionate about breastfeeding because I believe in the health benefits of it. The other important thing I like to stress is that breastfeeding is very important for the brain development of the infant. It's not just the breast milk, it's the actual position. When an infant is being held at the breast, there's the perfect eye-to-eye connection. There's the skin contact. The infant hears the mother's breathing heart, her breathing. And there's that close contact. So what we encourage is that skin to skin, the touch, can help with the brain stimulation in that infant and may contribute to the long-term benefits of breastfeeding, both for the infant and for the attachment between the infant and the mother. Breast milk is uniquely designed for human babies. The beauty of it is that it adapts to the changing requirements for the infant, and it's produced based on the sucking of the infant. So the more the demand, the greater the milk production. There's some suggestion that breastfeeding can be protective against future obesity in children. One thing that's beautiful about breastfeeding is that the baby takes exactly what it needs, and when it is full and no longer needs any more, it slows down its suckling. There's never any waste because the breast adjusts to the demands of the infant. That's why breastfeeding can be very important for prevention of obesity later in life. It is important for women to breastfeed as long as possible. Some women are successful at breastfeeding for 2 years and beyond. And it's really important that you balance the intake of solids with the breast milk as the predominant liquid nutrition for the infant. Breastfeeding is extremely easy for the mother-baby diet in that it's available, it's the perfect temperature, doesn't need to be sterilized, it's right there. So it's a very effective way for a new mother to lose some of the extra pregnancy weight. It's also very effective at helping her uterus go back to normal because of the release of hormones, oxytocin. There's also prolactin, which is formed. It's another hormone that's part of the whole process for breastfeeding. Breastfeeding is uniquely designed to help the woman's body regain its pre-pregnancy status.
Human lactation is such an amazing system. It's as amazing as any other part of the body. The eyes, the ears, the heart. Have you ever studied a part of the body and thought, oh, Mother Nature, she really didn't go all out on that one? Of course not. And human lactation is just as amazing. Breasts are not just to make sweaters look good. They have a very important reproductive function. When your baby is born, you are going to think, oh my goodness, Mother Nature has just brought the most beautiful little baby into our arms. And everything your body has done to make this baby, you will just be in awe. Well, it doesn't end there. Mother Nature made sure that human babies come through the pelvis while they can still fit. So yes, we need to make sure that moms are giving birth while they can fit the baby through the pelvis. But babies aren't ready to live in this world. They're young, and therefore Mother Nature compensated, and she gave us the breast. Just as your body nurtured and grew your baby in the uterus, your breast will continue to nurture and grow your baby once your baby is in your arms. Your breast will provide your baby with all the nutrients they need for optimal growth and development.
Why I help moms breastfeed is because it's what makes us feminine. It's the most feminine thing that we can do, because our bodies are made to grow babies and to give birth and to breastfeed. And this is why Creator made us women. And when moms and babies fall in love during breastfeeding, it can change a mom's perspective about life. She can feel important. She can feel that she has value. Breastfeed exclusively for 6 months, because that's about the only time in the baby's life that you're going to be the #1 person in their life. You're going to be there for the nutritional benefit. You're going to be there for the immunological benefit. You're going to be there for the mental health benefit, for the comfort and the love. When we breastfeed our babies, the babies know where their center is. They know where their soft and their safe spot is. And we can't tell moms to stop that. So for 6 months, that mom is the #1 person in that baby's life. Creator said women grow the babies. Creator said women are in charge of the food, and Creator gave women the breast. That's why we have breasts, is to feed our young. Now, our milk that we make is tailor-made to what that baby needs. So the milk's going to be different on day 1, or the colostrum is going to be different day 1 than it is on day 3 when the mature milk starts coming in. And that's different than the milk that's going to be there on day 10. And it's going to be different than in month 4 when they start putting things in their mouths and their immune system needs an extra boost. So nursing to 2 years, it does provide, I guess the standard answer would be immunological benefits and nutritional benefits. And it's more than just the love. And the immune benefits are really important, because when they're at 2, a lot of kids are in daycare, or they're getting out to more play groups, so they're getting exposed to a lot more germs. So babies need that nutritional boost that they will never get from formula. But it's worth it. It's worth every moment that you're lacking sleep. It's worth every moment when that baby's looking in your eyes and the milk's dripping out of their mouths. It takes a lot of dedication, but it's worth it. Moms and babies need to have that attachment. They need to have that bond. They need to have that love with each other. When babies are born, like the first hour or longer, they should be on that mom's chest. Babies should not be moved at all until that baby has their first breastfeed. Why? That's what they're made to do. Babies are given this gift from the Creator. So when they're born, they know how to get to their mom's breast and to breastfeed, and nobody has to do anything except make sure that baby's warm.
The recommendation currently by Health Canada is that women breastfeed exclusively, which means breastfeeding only or breast milk only, for the first 6 months, and then continued breastfeeding up to 2 years and beyond. The reason of exclusive breastfeeding for 6 months is that research has shown that there are a lot of health benefits to that. When a baby is born, their gut is not fully matured, and so therefore that initial colostrum and the initial milk really helps in the maturation of the gut, and so therefore that can have an effect on their health for the rest of their lives, basically. There's also the nutritional aspect of it, and so breast milk provides some kind of exactly what that baby needs, and even according to their gestational age. So that meaning if they've been born premature, the breast milk will be different than if a baby is born at term. It varies whether it's in the daytime or the night. The milk varies at the beginning of the feed to quench their thirst, and then gets higher in fat as they feed longer. So it's this, they're getting a product that's according to the baby. Another major factor is in terms of building the immune system of the baby, and so there have been a lot of studies done that have shown that babies have less visits to the emergency department for certain infections when they've been breastfed. And then there's the whole breastfeeding relationship, and the attachment that happens. And so a lot of things that are really important for the development of the brain and for the emotional development of a baby, they happen just kind of automatically when a person breastfeeds. So they have a skin-to-skin contact with the mom, they look at the mom's eyes, they hear her voice, and so there's just a lot of things in that relationship building that kind of, like I say, they just happen automatically when the baby is breastfeeding. In terms of continuing to breastfeed as the child gets older, again, that whole attachment and relationship benefits continue. As a baby gets older, they're eating other foods, so the nutritional aspect of breastfeeding probably has a little bit less importance, and because the other foods that they're eating are also important, but that sort of immune property or protection against infection continues to be important, and it really helps. A baby can really, or an older child can even get reassurance and calmed quite easily when they can just kind of breastfeed. So yeah, there's a lot of advantages to a baby and to the relationship. And there are also some advantages for mom. I think it helps her kind of maybe transition into her mothering role for some people. There are decreases in some types of cancer for women who breastfeed. Starting to show some research into the benefits in terms of less chance of diabetes when a mom gets older. And initially, usually the kind of postpartum bleeding stops sooner, and sometimes mothers lose weight a little bit easier when they're breastfeeding their babies. The current recommendation is that moms would breastfeed till the child's up to 2 years and beyond, and really it can go as long as it works for mom and baby. As a child gets older, they're out interacting with other children more, and they're going to be exposed to more germs, so that having the protection that breastfeeding provides is even even more of an added bonus as children get older. Breastfeeding has also been shown to have an influence on the brain development and affecting IQ, and this seems to be in relation to the fats that are in the breast milk, and that helps with the development of the nerves and the neurological system, in addition to the stimulation that they get while they're breastfeeding. It's been shown that if you look at, we are mammals, and if we look at our development as mammals compared to other mammals, and how we're developing kind of physically, it would show that the average age of weaning would be between 4 and 5 years of age. That's just kind of from a mammalian biological perspective. And then it's been shown in some cultures where babies are led to self-wean, that they often wean around 3 years of age. So we're looking at between 3 and 5 as maybe what might be what we would do as mammals.